Secretary Becerra, I want to go back to a topic that Senator Sheen mentioned, and that is that our communities are really being hammered by the opioid crisis. Just last year, more than 105,000 Americans died from a drug overdose. In Washington State, synthetic opioid use is up drastically. Overdose deaths are now up 66% since 2019, and over half of those are attributable to fentanyl. This is just unacceptable. We really need some urgent action from the administration. Can you talk to us about what your plan is to stop the harm being caused by opioids, especially fentanyl?
Well, Madam Chair, in response to some of Senator Blunt's questions, I mentioned that we have reorganized within HHS to make it a priority to address drug use and address the disorder that is there, especially with opioid. So we have come up with a different strategy. We forget about the stigma, we forget about the old way of doing it, and our strategy now not only relies on prevention and treatment, but on harm reduction and follow-up services so that we don't let people regress. And so what we're doing right now is working with local communities, because we don't do it at the federal level. We work with local communities with the resources you all are giving us to help beef up their capacity to provide not just testing and treatment, but also to help them with harm reduction.
Well, I am especially alarmed by the rise in overdose deaths among adolescents. Fatal overdoses among youth nearly doubled in 2020 and have continued to rise since then, which appears to be driven by these counterfeit pills that are laced with fentanyl. Parents in my state want to know, what is the Biden administration doing to protect our kids and prevent young people from seeking out illicit drugs and make life-saving overdose reversal drugs more available?
Well, Senator, we broke through that ceiling that existed that prevented us from supporting local successful operations that, for example, let someone know if the drug they were about to take was laced with fentanyl. The bugaboo back then, the stigma was, oh, you're helping someone take drugs. We'd rather save a life than judge that person who's about to take a drug, because they will take the drug whether we try to help them or not. And so today the federal government will support those local programs that are, for example, providing fentanyl strips to people so they can test that drug that they may be about to use to find out if it's going to have a harmful.
Does that help adolescents?
That would help anyone who comes in and who has access to that service from that local provider.
And kids would seek that out?
Oh, Madam Chair, there's everyone, every walk of life, every age as well, who's coming to some of these centers. Now, some of these kids may require some adult authorization in order to take certain treatments, but fentanyl strips are available for those who are about to inject themselves or use a drug that is, again, could likely kill them. And
kids know about this?
I suspect many adolescents are aware of some of the local anti-drug programs that are available. I can't tell you I know if they make use of them directly or not, and I can't tell you what every state has in terms of laws and making some of these services available to those who are adolescents, but I do know that those programs are made available to those who have drug issues.
Okay. Well, let me just change the topic a little bit. The pandemic, as you know, has been really hard on our kids and has turned their lives upside down. So they've lost time at school, time with their friends. Some have lost loved ones, and they're dealing with a lot of stress and anxiety and trauma, and they really need our help. But even before the pandemic, I was hearing from parents who are frustrated by how hard it is to find mental health services for their kids. The president's budget would invest heavily in crisis care systems, which I agree are important to handle emergency situations and prevent tragic outcomes. But let me be clear, children should not have to wait until their mental health hits this crisis point to be able to get care. Parents are really desperate to get help for their children here. How would this budget, particularly your proposal allowing states to use 10% of their mental health block grant funding for prevention and early intervention programs, help with that?
Madam Chair, let me point out one particular program that I know you and Senator Blunt have worked hard on over the course of some time, and that is the Certified Community Behavioral Health Clinics and how we are planning to expand access to those. We provide about $250 million for the expansion of those services, because we know that locally in the community, if a family, if a young person has access to those services, we get to them a lot sooner and perhaps save a life. And so we're going to try to expand that. The $51.7 billion 10-year investment that the President's making in mental health services is transformative. If you all pass that in the President's budget, we will be able to do far more in reaching these families, because too many, as you said, don't have the access they need.
Okay. Thank you very much. That will end our hearing today, and I want to thank my fellow committee members and Secretary Becerra for a very thoughtful discussion about how we can do more to support our communities and keep people safe and healthy and address the challenges we hear about from back home. For any senators who wish to ask additional questions, questions for the record will be due May 13th at 5 p.m. The hearing record will also remain open until then for members who wish to submit additional materials for the record. The committee will next meet in Dirksen 138 Wednesday, May 17th at 10 a.m. for a hearing on the Biden administration's budget request for the National Institutes of Health. Meeting is adjourned.